If you or a loved one are struggling with type 2 diabetes, you should visit the link in the description below. This clinically proven, drug-free program lowers blood sugar to a normal level and can completely reverse type 2 diabetes within just a few weeks. Here's today's video.
The question, has anyone ever gotten rid of diabetes? How did she do it? Answer by John Shore. So far I would say that I reversed the type 2 diabetes. I envision a cure, but I am being patient. In March of 2017 I was diagnosed with type 2 diabetes. It really scared me. My father was diagnosed with type 2 diabetes at 60 and I watched him have to inject insulin 2 times a day. His body still deteriorated due to the diabetes. I did not want to end up like that. I was a chocoholic and ate huge portions. I was too heavy for my height and did not get enough exercise. I immediately got on the internet and started researching for cures for type 2 diabetes. I read all the information at the American Diabetes Association website and was thoroughly depressed. I was being told that I had a progressive disease with no cure that would last the rest of my life and finally cause my death. I learned that I would have to take progressively stronger medications to control my diabetes and blood glucose levels. I decided that this path was not for me. I knew there had to be a cure for this terrible disease, even if all these doctors and pharmaceutical companies were saying that there is no cure. I read everything I could find on type 2 diabetes. Causes, treatments, reversal and cure. I decided that changing my diet drastically to a low-carb, high-fat diet, LCHF, was the way to go. I found a great deal of good information at Diet Doctor, making low-carb simple. So I did it. I absolutely changed my diet completely from that day. It was very difficult. My body was craving carbohydrates, especially sweets. I had physical flu symptoms from the body adjusting to this new diet. I used meditation and mindful eating to get through those days. Without meditation I doubt I would have made it. I even created some guided meditation audios that helped me. You can download them. They are called the Dieting Mindfulness Meditations. There are 2 of them. Use them both every day. They really help with changing your diet. No sweets, no fruits, less than 20 grams of carbs a day, no juices, no sweet drinks, no sugars of any kind except stevia. Veggies, eggs, cheese, meats, nuts were just fine. It was an incredibly difficult challenge. My endocrinologist thought I was crazy. She was not supportive at all. I told her that I was going to do this and that I would be the experiment to see if type 2 diabetes could be reversed and cured without medications and the diet she was recommending. I checked my BG at least 7 times a day after various meals, exercise, events, activities, etc. I wanted a complete picture of how everything I ate and experienced affected my BG. I found that stress raised BG. I found that lack of proper sleep raised my BG. Lack of exercise raised my BG. The meditations helped with the stress and with sleeping. I made sure I walked with my dog and my camera at least 5 kilometers per day and usually more. After 6 weeks on this diet my BG was completely normal for a non-diabetic person, 3.95.6 mmol/L. My A1C was a little on the high side though, 6.2. But that A1C included the weeks before my BG went down. My cholesterol was also high from all the fat I was eating. So I adjusted the diet to a more low-carb, low-fat diet. I consumed less than 50 grams of carbs a day and only ate lean chicken, fish and very lean meats. Lots of veggies, eggs, cheeses and still no fruits and juices or sugars. After 3 months more my A1C was 5.2 mmol/L. My BG never went above 5.6, 100, even after a meal. I had lost about 8 kilograms which felt great and still does. Now it has been 8 months since my diagnosis and the beginning of my experiment. I still check my BG every morning when I wake up. It is always in the normal range. Never over 5.6, 100. I walk every day with my dog and camera. I meditate every day to deal with any stress that might arise. I eat some fruit now. I eat fresh veggies and salads, fish, chicken. I'm now living in southern Italy so I have access to nice olive oil, cheeses and veggies. I eat carbs whenever I like. For instance, yesterday I was in Naples, Italy, the home of pizza. I ate an incredible pizza at the oldest pizza restaurant in Naples. I also had some bites of an amazing dessert called a baba. Very sweet and very delicious. For late dinner I had another incredible pizza. When I woke up this morning my BG was 5.4. I usually would not eat 2 pizzas in a day, but I used this as an experiment to see what would happen. Even here in Italy I only eat pizza about once a week. All other foods I eat in moderation. It is not my intention to ever go back to eating sweets constantly all day. I will stay on a good healthy diet and get plenty of exercise for the rest of my life. I like having less weight to carry around. I will continue to meditate and do my mindfulness meditations every day. Little by little I will experiment with my diet to see how my pancreas is working and how my cells are dealing with glucose and insulin. As long as my BG and A1C are normal, I will continue doing what I am doing. Is the T2 diabetes cured? I have no idea yet. Is it reversed? Most certainly. I have done this with no meds, only diet, exercise and meditation. Let me close by saying that every human body is a bit different. What worked for me may or may not work for you. In my research I have found that this diet works for most people, but do your own research. Obviously, in the short run, it is a lot easier to take a pill or an injection every day than to change your lifestyle. But that leads to nowhere. Changing diet and lifestyle is the long-term solution for many people, including me. I even set up a website about this at Dieting Mindfully by John Shore. Speak with your doctor. Do the research. Find what works for you. Then do it as if your life depended on it. Because it does. Take care, John. Answer by Michael Simpson. I want to first answer that there are several types of diabetes, although I think only 2 are relevant to your question. Type 1 diabetes is an autoimmune disease, that is, your own immune system attacks cells and organs of your body. In this case, the disease attacks cells in a particular region of your pancreas where insulin is manufactured. As a result, your body cannot control blood sugar. At this time, type 1 diabetes is considered incurable, although there are some cures that are in very early stages of research, so we do not know if they may or may not work. However, type 1 diabetes can be managed well with insulin injections, a very careful diet, and close monitoring of your blood glucose. Without insulin, type 1 diabetes is a death sentence for the patient. Type 2 diabetes is a metabolic disease not related to type 1, except that blood glucose levels are high. We don't know what exactly causes type 2 diabetes, but we do know that poor diet, obesity, lack of exercise, and genetics are correlated with the disease. It is treatable with oral drugs and, sometimes, with insulin. In addition, type 2 diabetes can be reversed, but not cured. In other words, with a strict diet, dropping weight to the preferred levels for your height and sex, lots of exercise, it is possible to reverse type 2 diabetes. However, you are not cured. Return to your old lifestyle of poor nutrition, lack of exercise, and weight gain, the diabetes will return. There is no miracle drug to cure type 2 diabetes. You'll see dozens of commercials on TV for drugs and injections for type 2 diabetes, but they just manage the disease, they do not cure it. There is one cure for type 2 diabetes if you are morbidly obese, that is 50 kilograms over ideal weight, gastric bypass surgery. The day after surgery, you will no longer require diabetes drugs, and you will lose weight. And you won't be eating pizza, hamburgers, or anything. At least if you want to keep the 50 or more kg you will lose. If you closely manage your blood sugar with either type 1 or type 2 diabetes, you can live a long, normal life. It'll be blunt here, except for a tiny percentage of type 2 diabetics, the disease is caused by their careless lifestyle for decades. Only a small percentage of type 2 diabetics ever get the discipline to reverse the disease. And many have out of control blood glucose, which will eventually lead to blindness, nerve dysfunction, cardiovascular disease, and many other problems. With either type 1 or type 2 diabetes, you have to be obsessive to keep it under control. Note, just for information purposes, the other 2 types of diabetes are gestational diabetes, a condition of high blood sugar while pregnant, and diabetes insipidus, where a hormone causes the kidneys to not work correctly, which keeps blood sugar high. Gestational diabetes is generally temporary, usually going away after the baby is born. Diabetes insipidus is a completely different disease and is treated differently. Answer by Kyra Rabenstein. Type 1 diabetes is currently considered incurable but can obviously be managed and controlled quite well with insulin therapy tailored to individual requirements. The biggest causative contributor to the development of type 2 diabetes, besides a slight genetic impact, is undoubtedly obesity, which of course itself has a strong genetic causation. T2DM that develops in conjunction with obesity can, if addressed early on, be reversed with either a rigorous program of diet and lifestyle changes, success rate around 10%, or with metabolic surgery, success rate around 75%. Once T2DM has been established for longer than 2 years, the success rate of surgical and non-surgical metabolic interventions in terms of diabetes reversal drops off dramatically, even if significant weight loss is achieved. So, if you have recently been diagnosed with T2DM and are obese, the best advice would be to try and achieve serious weight loss and increase cardiovascular fitness, either through surgical or non-surgical approaches, as quickly as is practicable. Because the success rate of non-surgical approaches is so low, and most patients have been trying and failing to achieve and maintain weight loss for much of their lives, bariatric/metabolic surgery is highly advisable and in competent hands achieves excellent results. An accompanying program of dietary advice, psychological evaluation and peer support is crucial, too.